Okay, ladies, we're talking menopause. You know that already. And I'm very excited because Women's Health Arizona is a very large group of doctors, including these two beautiful ladies right here, who can help you with your symptoms or even discover if you're even in menopause. So I am with Dr. Alyssa Floman and Dr. Karen Estrada. I am so excited to have you guys on this show. It's really, really important because I have so many questions, right?
All right.
Okay, I want to start with you, Dr. Estrada. What is menopause?
Menopause is a transition. It is a time when your brain starts talking differently to your ovaries. In your younger reproductive years, that signaling is very organized. And so as you age, that signaling gets a little bit chaotic. Yeah. And so that's why we call it the menopause transition, rather than just, are you in menopause? We say a menopause transition because symptoms can start a little bit earlier. The diagnosis of menopause is a clinical one. 12 months without a period.
Okay.
But it's a little bit more than that because symptoms can start before and last for several years, and then they can persist beyond your last menstrual period as well.
Oh my gosh. I was hoping you would have hope for us. I'm not hearing
It is hopeful.
Okay.
It is hopeful. We've come so far in how we manage menopausal symptoms.
I'm happy to hear that.
Our understanding.
Right.
And the options we have available. Really personalized medicine now.
Yes, and that is so important. And that's exactly what you guys do. And this is what we were talking about prior. And and it's very refreshing to hear on how much time you spend with a patient, because you have to, there's so much that you have to learn. So
absolutely.
When you sit with a patient, Dr. Floman, what are some of the things that you need to find out, and some of the tests that, or do you run tests to find out, in fact, if we are in menopause?
So as far as, I think the biggest thing is getting a very comprehensive history from the patient. It's really important to hear what are they experiencing at home, what brought them in to see me, because honestly, they feel like they're going crazy.
Right. Yes,
they may have actually been to a couple doctors who've kind of told them that nothing's wrong with you.
And you think you're crazy.
So
right?
I think it's really important to get a comprehensive just history of everything that's going on. You know, sometimes we do run tests. It doesn't always mean that we're going to do, hey, we got to wait until we get all this test results back before we initiate some sort of a treatment plan.
Okay.
But we can definitely, take a look and make sure we're also looking at other conditions, whether that's cardiac or even sleep apnea, thyroid. There's many different things that could be mimicking some of the symptoms they're having. So it's really important to make sure that they're, not missing those things too.
So once you rule out some of the other issues that could be causing some of our symptoms, right? Then how do you treat? And I know everybody's different, and I think all women watching going, but my sister was different, I'm different, my mother's different. So how do you then determine what type of treatment plan to come up with?
I think the important thing is we don't have to wait. You can initiate either non-hormonal or hormonal options for the management of the menopause transition while continuing to make sure that we are not missing these other medical problems.
And I'm guessing that because our bodies are changing all the time, it's very important to continue that dialogue,
Absolutely.
right? To come in and say, hey, this isn't working, or, it's been 6 months and I don't feel any better.
I think it's very individualized plans, and honestly, they're very fluid as well. So you aren't going to necessarily, what worked for you for the first 6 months or maybe in the first 2 years may not continue to work for you, and we have to continue to work on that plan.
And it can go for a length of time, and it's different for every woman, but then is this something that I think women are saying to themselves, is this my life now? We don't know, right?
It's a transition. So I guess it's finding that grace and that acceptance of what an empowered transition can look like, right? It doesn't have to be a miserable experience.
Yes.
Right.
I like to call it the menosphere. So there's lots of, I think, more awareness about management of symptoms, awareness of other secondary symptoms, things like tinnitus, ringing in the ears, joint pain. Those other secondary symptoms, I think we're more aware of now, and we're better at addressing them.
Excellent. Yeah. Ladies, thank you so much for joining us on this very special show. I appreciate you. Here's more information. Women's Health Arizona, they have 25 locations across the valley in Prescott. Book online at womenshealthaz.com.